Do you still use your Apple Watch to check on your heartbeat? Well, this pocket device can see 6 times more than the Apple Watch. It's called the KardiaMobile 6L by AliveCor. And today, we're going to explain what it does, what it can detect, and why atrial fibrillation matters so much, and how this device compares to the ECG you have in your hospital. Let's go back to the basics. What exactly is an ECG? ECG stands for electrocardiogram, and an ECG is a test that records the electrical signals that make your heart beat. And every time your heart beats, it produces a small electrical impulse, and an ECG measures that impulse and shows whether your heart rhythm is normal or abnormal. In hospitals, you usually use something called a 12-lead ECG, and that's where you lie on a bed and we attach multiple sticky pads across your chest, arms and your legs, and then wires connect those pads to a machine, and that machine generates 12 different views of your heart's electrical activity. It's very detailed, but it requires equipment, staff and a clinical setting. So what exactly is this tiny device called the KardiaMobile 6L? Well, the KardiaMobile 6L is a portable ECG, and it's a device you can use at home. So instead of all the wires and chest stickers, you simply place 2 stickers on the top of the device and rest the bottom against your left leg. And within 30 seconds, it records a 6-lead ECG. So instead of 12 views like in the hospital, you get 6 views. And that's a lot more information than a single lead or 1-lead ECG. But it's still a little bit more simple than a full-blown hospital ECG. The results then appear on your phone on the Kardia app, and you can generate a report to share with your GP or cardiologist. What exactly can the KardiaMobile 6L detect? Well, the most important condition it can detect is atrial fibrillation, also known as AF. And atrial fibrillation is an irregular heart rhythm. So instead of beating in a steady, organized way, the heart beats in a chaotic and uneven fashion. The device can also detect if your heart rate is too slow. This is called bradycardia in medical terms, and some people do naturally have a slower heart rate, especially if they're very fit. But in some cases, a heart rate that is too slow can cause dizziness, fatigue, or even fainting. It can also detect if your heart rate is too fast, and this is called tachycardia. A fast heart rate can cause pounding in the chest, anxiety, or breathing issues. With the advanced membership, it can pick up extra beats, and some people experience these from time to time. They can feel like a sudden thump or a skipped beat. Often they are harmless, but in some people they can be frequent and it can be a cause for concern. So capturing them can be very helpful. It can also measure the timing between beats, something called the QT interval, which you don't need to remember in detail, but it is important for people on certain medications or those with specific inherited heart conditions. So in simple terms, the device can tell if your heart is too slow or too fast, if your rhythm is regular or irregular. Are there any unusual extra beats? And does the electrical timing look normal? Did you know that 1 in 50 people have atrial fibrillation or AF? And this tiny device can pick it up at home. AF increases your chance of developing a stroke. When the heart beats in an irregular fashion, blood pools in the heart, and when blood pools, it increases the chance of forming a clot. And if the clot travels to the brain, it can block blood flow and cause a stroke. AF is one of the leading causes of a preventable stroke. And the challenge is that AF is often silent. Some people may feel fluttering in their chest, or breathlessness, or feeling a bit tired, but many feel absolutely nothing at all. And that's why being able to check your rhythm at home can be super powerful. And studies have shown that the KardiaMobile 6L is very accurate at detecting atrial fibrillation. What can the KardiaMobile 6L miss? And when should you absolutely ignore it and call for help? It's important to be very clear about this. If you develop any chest pain or severe symptoms, you still need to be seen in the hospital, as this device cannot detect a heart attack, and it does not give the same full-blown information as a 12-lead ECG in the hospital. So, in conclusion, our final thoughts from Doc Dialogue. Tech such as the KardiaMobile 6L is bringing more healthcare into the home, and this definitely supports conversations between doctors and patients. And when it comes to conditions like atrial fibrillation, early detection can reduce the risk of developing a stroke, and this could potentially save your life. If you found this helpful, subscribe to Doc Dialogue, and remember, if you have any severe symptoms, seek urgent medical care.